performing skill number 18, provides catheter care. Hi, my name is Caroline. Can I come in? Hi, what would you like to be called? Anna. Hi, Anna. We're going to provide some catheter care. But first thing we're going to do is we're going to make sure we have your call light within reach. We're going to make sure your bed is down low. We're going to make sure the brakes are locked. And we're going to provide some privacy. Anna, I'm going to go get some supplies. I'll be right back. A basin, some soap. We also need a towel or a protective barrier. And for this skill, we need 3 washcloths. 1 to wash, 1 to rinse, 1 to dry, okay? We are going to get some water, warm water. You want to test the water and make sure it's warm. And we want to have the client test the water. Miss Anna, would you like to please test this water and make sure it's a comfortable temperature for you? How does that feel? Warm? Okay, good. We will sit that down and we will put on our gloves. Anna, we're going to put a protective pad under you. So I'm going to expose you just a little bit. Again, you can use a towel or you can use this protective pad. This side would go on the bed and this side would go on the patient's skin. But I'm going to go ahead and use a towel. I'm going to uncover her just down to her knees. I don't need to overly expose her, and I'm going to bring her gown up, exposing just the areas I need. Take the towel, and you can roll it and put that under her hips. Anna, can you lift on 3? 1, 2, 3. She lifts. If she can't lift, you need to roll her over. Remember, you don't need to overly expose her. All right. Now we're going to get our first washcloth. We're going to wet it. And we're going to apply soap. Add soap. Get a nice little lather. And I'm going to be touching you. Put your hand on the meatus, so you're holding really close right there, so you make sure you don't pull the catheter out. There should be no tugging and no pulling. You want to wrap your washcloth around the tube and wash all the way down, at least 4 inches. I generally just go all the way down, wiping 1 time as long as I got the entire tube. Now, if you do need to go back and wash again, you need to flip the washcloth to a different surface for every stroke. But I only needed to do it 1 time because I did include the entire tube. You want to take that and put that in the linen. Then you want to rinse it. Again, you can wrap your washcloth completely around, holding at the meatus. We are rinsing, and you want to go all the way down, not pulling, gently down. Now, if you can't do it that way, you can flip it over, and you can twist down. Just a gentle twist, okay? And you want to get rid of that one. Now you want to dry. Now with drying, hold at the meatus. I tend to pat down. Pat, 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 so I don't pull that tube. Pat all the way down, okay? If you need to dry again, you need to flip your washcloth to a different area. Get rid of that. Now you want to remove your linen protector. Anna, could you lift your hips up? 1, 2, 3. She moved. Make sure that tubing is okay. Don't contaminate yourself. Don't let the linen touch you. Bring her gown down. Cover her up. We want to make sure she has her call light before we walk away. She has her call light within reach. Her bed is still low. And I'm going to go get rid of the water. In the designated dirty area, you can dump your water in the sink. Rinse it. And dry it. You must dry your basin. Okay? Put that in the designated dirty area. Remove your gloves. Wash your hands for 20 seconds. Make sure she still has her call light in place. Make sure her bed is still low, still locked, and you can remove the privacy. Anna, our skill is all complete. Most people forget this. Once you place that linen protector under their hip area, which is the buttocks area, remember you're using that to protect the bed from getting wet. So it does get a little wet when you're doing this skill. You got to remember at the end, before you cover them up with that blanket, you see that protective linen, you need to remove it when you see it. So take it out, don't let it touch your clothes because it's contaminating you, and put it right in the linen basket.